Welcome, everyone, to the Green Nurse Podcast, where we bring hope and inspiration for growth and healing. We're here to change the dialogue and stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. You deserve to feel good. We all deserve to feel good. And I have a little video about what we do in the cannabis space as nurses. And then we're going to get started on our very powerful, important interview today with Dr. Slater.
Please help me change the paradigm of healthcare.
The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I'm the founder of Holistic Caring. We're based here in California, and we do educational programs and case management for patients on how to use cannabis therapeutically as a medicine.
We're also here to decrease stigma around what it means to feel good and be high, hence the H for hope, I for inspiration, G for growth, and H for healing.
As the founder of Holistic Caring, I basically oversee the whole ship, and what we're doing is progressive education.
Cannabis actually supports all 11 organ systems, our immune system, and all the neurotransmitter signaling systems that give messages to tell our body to either do something or not do something. Because the plant was prohibited, it prevented health professionals, doctors and nurses, from learning about cannabis as medicine.
I want to change the paradigm of healthcare and us paving the way into a new vanguard of medicine.
It's about education, it's about empowerment, it's about teaching people how to feel good, bridging the gap from what they're not getting from traditional medicine, utilizing different plant medicines, adaptogens, tips, tricks, hugs, and nugs of information to support and nourish the most important system in our body.
And it's a lot of soul work, a lot of love, a lot of discipline, and meditation. I'm using my life work as a testimony to others to learn how they can be their own hero and then go help heal the world.
And we are, as nurses, the game changers.
Welcome, everyone, here to the Green Nurse Podcast. My name is Sherri Mack, and I'm Chief Nursing Officer and co-founder of Holistic Caring and the Green Nurse, Vice President of Nursing at Bloom Hemp CBD. I'm a cannabis nurse, patient, advocate, activist, and a very passionate podcaster here to change the paradigm of healthcare. This is my 8th year podcasting, The Green Nurse Living Your Best Life. I started podcasting back in 2018 when the National Council State Boards of Nursing came out with their guidelines that all nurses must have 6 essential areas of knowledge when it comes to cannabis as a medicine. I started podcasting to share compelling stories of healing and to decrease stigma, since I too use cannabis as a medicine. Before we get started on our very exciting show, we do have a message from our sponsors at Bloom Hemp. Bloom Hemp is a woman and nurse-owned national hemp CBD supplier, leading with quality, safety, and valued patient-centered care. Bloom Hemp products are USDA organic CBD grown in the mountains of Colorado and tested for purity, potency, cannabinoid, and terpene profiles. Bloom Hemp is proud to offer a free nurse line to answer any questions to explain how and why CBD works in the body. Now we're going to get into our show. So I'm not sure if you all know this, but cannabis nursing has been recognized as a specialty, and nurses are truly making an impact on advocating for the safe therapeutic use of cannabis by teaching on the endocannabinoid system and how to optimize cannabis as a medicine for health, healing, and wellness purposes. As plant medicine nurses, our role extends beyond recommending cannabis and hemp products. We strive to provide alternative solutions from multiple modalities that support and nourish the endocannabinoid system, promoting that health, healing, and overall wellness. Pediatric nursing has always held a very special place in my heart. I'm going to tell you, this is a great story. Initially, I found it to be one of the most challenging areas during nursing school. Actually, I really often worried about unintentionally causing harm to these kids, a fear that left me so anxious when caring for a distressed child and understandably their concerned parents. But everything changed when I became a parent myself, and particularly to a child with a rare genetic disorder who required a lot of care and had over 12 surgeries in the first year of his life. After my son was stabilized, I pursued my passion and became a pediatric nurse. I saw how things could be done differently and brought my experience as a mom with an abled child to my nursing career. I specialized in home care with specialty on a home infusion therapy and had the privilege of supporting countless children in their families as their home IV nurse. So today, my pediatric journey has brought me to a new role as a pediatric cannabis nurse through our company, Holistic Caring and the Green Nurse, and I educate families on the safe and effective use of cannabinoids, including cannabis and hemp-derived CBD, to manage symptoms of chronic illness and for wellness. My goal is to empower families with knowledge and provide compassionate care through this innovative approach to medicine. And this is why I'm so excited to introduce our guest today, who is a nurse practitioner who also specializes in pediatrics and cannabinoid therapeutics. Dr. Sara Slater is a doctor of nurse practitioner and pediatric nurse practitioner, mom of two. She's the founder of Balance Kids, a concierge pediatric practice serving families in Minnesota's Twin Cities metro. With over 15 years of pediatric healthcare expertise, including the last 3 years in pediatric cancer and blood disorders, Sara witnessed firsthand the critical gaps between modern medicine and holistic integrative care. While certifying young patients for medical cannabis, she recognized how limited education and institutional restrictions left families without the information they needed to make informed choices. That realization inspired her to create Balance Kids, where care is designed to meet families where they're at, both literally with in-home virtual visits and figuratively by supporting whole family health with compassion and balance. Sara is uniquely trained with a doctorate of practice, again, of integrative lifestyle coach through the Andrew Weil Center for Integrative Medicine at the University of Arizona and a holistic caring cannabis nurse health coach. She holds other cannabis certifications from leading experts such as Dr. Bonnie Goldstein and Dr. Dustin Sulak, and her approach centers on the endocannabinoid system, a vital but often overlooked part of health, helping families explore evidence-based options that range from preventative lifestyle support to, when appropriate, medical cannabis. Through Balanced Care, Sara blends the best of modern pediatrics with integrative endocannabinoid system-informed care, making healthcare more accessible, personalized, and truly supportive of family wellness. Right? And so when we're taking care of a child, we're also taking care of the family. So welcome to the show, Sara. It's such a pleasure to have you here today. Thank you for joining us.
Thank you. I'm so excited to be here and chatting with you.
Yes.
I'm really happy to be here.
Sorry about that glitch at the beginning. You just never know what's going to happen with podcasting and internet and videos. You just never know. So I'm
Totally
glad
okay.
we could move beyond it. But you know what, my very first question that I have for you, and this is kind of how I start off with a lot of health professionals that are now doing cannabis as medicine, because you didn't just wake up one day and say, hey, I'm going to be a cannabis nurse, right? There's usually a compelling story that led you down the plant medicine rabbit hole. And I'd love for you to share what inspired you to become a cannabis nurse.
Yeah, I never thought that I would be doing this either. And when I was younger, I was very anti-cannabis. I believed raised in the DARE era, cannabis is bad. And then as I, matured, it was basically, well, I don't care if people do it, but I'm not going to do cannabis and I was only focused on THC. I didn't know anything else about the plant. And then throughout my career, I would occasionally come across pediatric patients that did use medical cannabis. I didn't understand anything about it. But when I got my doctorate and then started working as a oncology pediatric nurse practitioner, I started certifying for it. And in the state of Minnesota, that's all we have to do. We just recognize that, like, hey, your diagnosis qualifies you to be a state medical cannabis patient. I'll refer you. But aside from that, we don't do anything, no education. It's just go talk to the dispensary pharmacist. We don't track even like what they're taking day to day and how that might impact potential therapies that we're giving them. So I started to recognize that gap and just wanted to learn, like, what does it actually do in the body?
Yeah.
There's families who are always asking, is it going to help cancer? And I was like, I don't know. I think it's all anecdotal. And then I went on the Google engine, then found the ACNA and holistic caring, and was just amazed that the ACNA is recognized by the American Nurses Association. And everything it was just a domino effect. I found holistic caring. I jumped on to one of your, what do we call your group mentoring sessions.
Yep.
And because I remember you guys were like, oh, we don't have a member named Sarah. And I was kind of like, I don't know, I'm not supposed to be here. I was just curious what this is about.
Oh yeah.
Um,
Okay. All right.
yeah, but you guys were,
Sorry.
yeah, no, you guys were so welcoming and let me stay on. And I was just so excited by that. And then I started connecting with other people in the cannabis world and learning from them. And everything steamrolled. And then I just became obsessed with telling everybody about the endocannabinoid system and everything that cannabis can offer and the history behind prohibition. And I've just become a full-blown advocate, and I'm obsessed with telling people about it, whether they like it or not. And
Okay.
so now I like to bring it into my care. So
Absolutely. So, okay, so this is an important question too. So basically, in Minnesota, when you became a certifying provider, were there any criteria for you to do that? Like, did they have you watch any?
all I had to do was just submit a very basic application, verifying my credentials, verifying that I had a DEA license. And then I believe there was like a very simple background check done by the state, and then they just give you a phone call to verify your identity. And then your account is made, and that's it.
Okay. Okay. So, you wrote a blog for us, and I was reading the blog, and it was very powerful and very informative. And if you look at the bottom of the notes here, people, you can click on the blog to read all about Dr. Sara Slater and her journey of becoming a cannabis nurse and what happened to her because she was sharing education in the space. So can you share what happened at Children's Minnesota that ultimately led to your termination? I know this is a hot topic, and it's a lot. And thank you for your bravery and your honesty and for your authenticity in coming on here to share what happened, because this is happening a lot to other nurses, and it shouldn't. For sharing information and education, to improve a patient's quality of life. So what happened?
Absolutely. Yeah. So, as mentioned, I was certifying patients and, eventually got to a point where I was certifying multiple and realized I should know something about it. So I started kind of becoming known in my department as being the person who knew about cannabis and loved to teach about it. And so coworkers would ask me questions, families would ask me questions. My department knew I was educating about it. Nobody had an issue. Multiple colleagues were just concerned because I think historically things have happened in the past and they were just worried about me getting in trouble. But I felt that I was following hospital policy and state law and following my scope of practice to the best of my abilities. I went on to provide education for my department, teaching them about the endocannabinoid system during a presentation and about the history of cannabis and the various properties of the plant. And that was well received. And then as time went on, I had more patients that I'm teaching about it, right? And I had a very young child with a devastating, um, aggressive brain tumor, and the family wanted to know all about cannabis. Another nurse practitioner had actually certified this child, so I wasn't doing the certification, but I had said like, hey, I see you're certified. Do you have questions about it? And they had a lot. There's no one in the hospital to answer these questions. And this is a child who has been in the hospital for months. So they wanted to know all about, the proven benefits of it for nausea, vomiting, helping to support his weight and appetite, and helping with pain. And they also wanted to understand the anecdotal, so how cannabis supposedly can work against cancer cells. So I gave them all the information. I gave them handouts that included like what CBD is, what CBG is, what THC is, what is the endocannabinoid system, handouts that had resources to many other resources that they could just dig through on their free time. I handed them studies. What happened, unfortunately, as I was rounding on this patient for multiple days in a row, and then I guess one of the times when I was off for the day or assigned to work in the clinic instead of inpatient, another provider saw the educational handouts that I had given, became concerned, filed a complaint with the compliance and risk team. Word trickled down to me from a colleague, and so I knew there was something going on. So I reached out to risk myself, which was something I had intended to do for some time, to just advocate for policy within the hospital that would support medical cannabis certifying providers to align with state law, because we had no language to support that. Our policies only said to refer to state law, and it only summarized how the actual cannabis product should be managed when a patient brings it into the hospital. So that report was made. I reached out to them myself, got no response from my supervisor either. It was really unfortunate. And within a week later, I just got a call from HR, and they were putting me on mandatory unpaid administrative leave. And then, long story
When they
short,
called you up and they said you're on unpaid administrative leave, what did you
Mhm.
say? Why?
Yeah, why? They couldn't tell me why. I was like, what do you mean? You can't tell me why. They're like, well, all I can tell you is a report has been made and we need to investigate it. And so, yeah, they wouldn't say what the complaint or the report was. They wouldn't say what was doing. The only thing that she did say was that, well, it has something to do with your behavior. I'm like, my behavior? I have no.
Yeah.
It was just baffling. I was baffled. In my gut, I knew it was about cannabis because there's nothing else. I have had a great history with that workplace the entire time that I had worked there. So I knew it was about that, but I was just baffled because I'm following state law. I was working within the hospital policies to the best of my ability.
And
No
you were
one.
following National Council State Boards of Nursing. This is
Yes.
essential areas of knowledge. So you basically my rebuttal would have been like, yeah, have you seen this? Hold up the NCSBN guidelines and be like, listen, this was put out by the Nurse Journal of Nursing Regulation, that all nurses must have 6 essential areas of knowledge when it comes to cannabis as medicine, and what nurses need to do when they're interacting with families that have questions. You don't just sweep it under the carpet.
No, no. And they just leave them hanging. And then what do they do if they're left hanging? They go and just research on Google, and you never know what type of forum they're reading. Are they getting reliable advice? And so
Yeah.
it was, yeah.
That's going to be my next question. So what was it like for you, both personally and professionally, to go through that experience?
It was rough. I would say, other than losing like a close family member, it was definitely one of the hardest times of my life, I think. It was so stressful on my family, like not really knowing if I was going to go back to work, when I was going to go back to work. What do we need to worry about in regards to finances? Do I need to start looking for a job? You know, everything is just spiraling. And I felt embarrassed too. Like, and not only that, I was also told not to tell my colleagues anything that was going on. So I was getting text messages from them asking if I was okay. But HR told me not to talk to anyone. And I was afraid if I did, that that would also be used against me as reason for termination. Um, so I just felt so stuck. I felt so alone. I was so angry because the people putting me on leave know nothing about cannabis. They know nothing about oncology care, just nothing. So it was tough. It was definitely tough.
So, how did the families respond to the education you were providing on cannabis? And did that contrast to how the institution viewed it?
Absolutely. It would definitely contrast. Families responded to it very positively. If they didn't want to go there, they would just say no.
Yeah, and you were
But more often than not, they wanted to learn about it. And I don't know how many times, like a mother would tell me, like, thank you. This is like they just express feeling so alone and not being able to do anything for their child. But then when I teach them about cannabis and how it can be used and educate them and what they're able to do with it, they just express a sense of relief because they feel like there's something they can control now and something that they can do themselves to help their child. Whereas, in the hospital, we take care of it all. And I think sometimes families feel a little steamrolled by that. So it gave them some empowerment.
Yeah, and this is important for people to understand. The scariest thing about cannabis as medicine isn't cannabis, it's the law.
Yes.
That's a fact, right? And what could happen. And so I could see how parents could be scared because they too, if someone reports them, I've heard I took care of a child in the UK who, the parents, they got into trouble, they in the Department of Family, DCSF, Department of Family and Children, gotten involved, and can make life very difficult for families.
Mhm.
And all parents want to do for their child is to help them get better and to feel better, right? And to have a quality of life. And a cancer diagnosis for a child is horrible for any parent. I mean, my kid had a rare genetic disorder, and and that was really rough. So I can't even imagine having a child with cancer, because because the treatments for cancer aren't all that great. They really aren't. And when you look at the efficacy, the standard of care is really lacking biopsychosocial spiritual support around the cancer care journey. It's just pills and procedures, radiation, chemotherapy, targeted therapies, lab draws, one thing after another. And there's missing such a huge piece of what could be helpful. And then you have the pleiotropic nature of this plant. It's my favorite word that Elizabeth taught me. The pleiotropy working on multiple systems and multiple symptoms and multiple conditions, all at the exact same time, non-toxic, to these kids, and can really support and help them bridge the gap from what they're not getting from conventional care. So that leads me to my next question is, why do you think cannabis education is so restricted in mainstream pediatric medicine?
I don't know. It's baffling. I have theories. One, the people with the power to fire you, as in in my scenario, they don't have the education behind it. And frankly, I don't think they're interested in learning. And two, I kind of theorized maybe it has something to do with Medicare, because Medicare is federal,
Yeah.
cannabis is federally illegal. So maybe there
Yeah.
could be some kind of the hospital might fear potentially losing reimbursement if something happened crazy. I'm really not sure. I understand people are fearful of it. Nobody wants to intoxicate a child. But it's, I think it's a very layered, complex
Very
answer.
layered. And I think it has to do with Schedule 1. So hopefully we'll see, either descheduling or rescheduling soon. So more,
Mm-hmm.
physicians and can get on board because, as of today, I always look on the American Medical Association every single day. I look because I'm so curious. Nurses are the only ones that have taken a positive stance for cannabis as medicine. The American Medical Association still does not approve of cannabis as a medicine. They only approve of FDA approved medicines. And according to the FDA, you can't make any claims to cure, treat, or prevent a disease unless it's an FDA approved medicine. So I think that's a big part of it. Also, a big part of it too is I remember this was years ago when I was in Massachusetts. I was training actually an integrative functional health doctor, a cardiologist. He wanted to offer cannabis consultations in his office and do medical cards. And I spent 6 months with him once a week for 3 hours every week. I went to his office and we worked together and we did all this amazing stuff. And he went to go do it and, to apply to be able to certify it. And he basically said they were going to take away his Medicare prescribing rights. So he was just like, I can't do that to my patients. So, basically I got all the referrals.
Mm-hmm.
This was something that he wanted to do in his office, but he was restricted and limited in what he could do because then he was going to lose his ability to take care of Medicare patients. And that was a big majority of his patient population. So what does your story reveal about the bigger gaps or barriers in our healthcare system?
Oh, I think it reveals that, like, I think a lot of healthcare providers and nurses are starting to feel that it's a more welcomed topic than it once was.
Yeah.
Um, and while that's true, I think it reveals that there's still massive hurdles that need to be overcome.
Yeah.
It shows how detached I think administration is from the actual medical healthcare providers.
Yeah.
And just it really shows there's a massive gap there and it's not benefiting patients.
Yeah. No, not at all. I mean,
Mm-mm.
it all comes down to money too, right? Like
It really does.
don't want to lose funding and lose their money. So that was like leading into the next question. Do you think that your termination was more about institutional fear and stigma or about actual patient safety?
I think it was more institutional fear and stigma for sure.
I totally
And
agree.
that was when I was put on leave, that was one of the questions I asked because I asked, did I violate any policies? And they told me no. Despite that, when I was officially terminated, it was all for policy violations because, there's nothing else they can say. Um, but where was I going with this? Oh, yeah. So I asked if I violated any policies. They said no. I asked if I threatened patient safety, and they said no. I asked if a patient complained. They said no. So I was like, okay, then what is it? And they just wouldn't say anything. Um, I didn't find out what was actually the source of the original complaint until I had to have a court hearing with the judge I was fighting for unemployment payouts. Because due to my termination status, I could not collect unemployment. And I fought that. I got a court hearing over the telephone with Children's and the judge. And the judge had asked a question which triggered the HR representative to say that it was a provider who was following me that was concerned about papers that they had seen in the patient's room that I had provided to them. So yeah, I kind of lost my train of thought, but ultimately I think it's more institutional stigma, fear,
Yeah.
worried about potential repercussions down the road. Because I mean, they gave me no verbal warnings, no written warnings, nothing. The only thing I was told was to not talk about my business at work, and I did not do that. So that was not used against me at all. They couldn't. Um, so yeah, eh,
Yeah. Wow. Yeah, that's sucks. That's just the
yeah,
bottom line. It really
it does
does.
suck. And like they didn't give anyone an opportunity to speak on my behalf, to ask what it was like working with me. It was just nothing. None of my colleagues knew what was like going on. They just kept it all quiet and then I was gone. And once I was gone, I could tell them what happened.
Wow. That's hard. That's really hard. You just almost feel betrayed by it's a betrayal by the system that you were representing, and you were doing good and
Mhm.
causing no harm and didn't violate anything, but because of their fear and lack of education and inability to have compassion, for
Mhm.
patients that are seeking something alternative and different, gosh, wow. So looking back, what gave you the courage to stand by your patients and provide that education, even knowing the risks?
It just felt like what was right.
Doing the right thing. That's right.
Honestly, that's it. And I know I'm educated on it and I know I'm qualified. And I also did believe that I was working within hospital policy. So I really didn't think I was doing anything wrong. I thought that I was really helping families. Um, and I mean, they would receive it so well, like they wanted that information. They really wanted it. And so, of course, I want to provide it to them. So.
Yeah. So what do you want other providers, parents, and institutions to learn from your story? Because it is a very powerful story.
I want them to learn about the endocannabinoid system and actually about how it works. And I want the administration to actually listen. One of the comments they made during my hearing was like, "Oh my gosh, we learned so much about CBD through this process." And I was just like, "You couldn't have asked me about
Well, and that's the other thing too, that's really important is that what providers and people that are uneducated on cannabis as medicine don't understand is that you can nuance, fine tune, support, upregulate the endocannabinoid system without cannabis.
it?"
Like
Hmm.
this is a system that's influenced by every single thing that we tell a patient to do or not do. So in
Hmm.
other words, if we're telling a patient to do something and it may have an impact on the endocannabinoid system, don't you think we have a responsibility to try to give them information on how they can mitigate that potential side effect and cause a further, right? So we know the more pharmaceuticals that you're on, you have a drug nutrient depletion, it's going to cause an endocannabinoid system deficiency, right? We know that as we age, our endocannabinoid systems is fully matured by the age of 25. And as we get older, because of lifestyle, the diet, I could say the fast food, fried food, fake food, artificial flavors, artificial coloring, trans fat, hydrogenated oils, high fructose corn syrup, alcohol, tobacco, environmental toxins all have a negative impact on this endocannabinoid system. And so the
Hmm.
teaching, cannabis and hemp products is a tool in the toolbox to support and nourish the system. But there's other things that we tell our patients to do that's also going to influence the endocannabinoid system. So it doesn't necessarily need to always be about product or consumption, right? It could be teaching on the system and how to take care of it in ways that don't even involve cannabis. But cannabis and hemp products can actually make some of those other therapies work better because they work in synergy. The entourage effect, the whole of the plant is greater than its individual parts, is the same thing as the entourage of care that we provide as nurses and recommendations that we provide to support that system.
Hmm.
So,
One thing I want to go back to too is what I would want to say too is to administration is if you really care about patient outcomes and meeting people where they are and providing holistic patient family-centered care, then they need to allow this. And doing what happened to me is completely wrong. You are not benefiting the patients by restricting this information.
well, because the thing is it doesn't make sense at all because you're allowed to certify, but then you can't educate.
Exactly. No.
That's totally not right. That's just kind of like, okay, I'm going to do a procedure on you, but I'm not going to educate you on why I'm doing that
Mhm.
procedure. You're going
It
to
would
have an
never work.
operation. I'm going to cut you from head to toe, but you can't know why, right?
Nope.
Doesn't make
It
any
would
sense,
never work.
right? Yeah, and it's the thing is that the patients are asking for it, so it's not like you're giving them unsolicited
No,
information.
I'm not pushing it on them at all. It's
No.
mm-mm.
No, so that's the analogy I would make is, when you operate on a patient, what do you do? When you're going to do a procedure on a patient, when you prescribe a medication to a patient, what do? You educate them on that, on
Mhm.
all aspects of it and how it's going to affect their body and any potential side effects and how to mitigate those side effects and best practices, et cetera, et cetera. Why would that be any different for cannabis? Here we
Yeah.
go. Yeah. So this is where we get more exciting. So this is where we're going to get into the exciting part of the interview. So this painful, horrible experience did become a catalyst for your next chapter. So let's talk about that.
Yeah.
How that happened.
So during my spiral, when I didn't know what was gonna happen, I was applying for jobs, trying to think of what I could do independently, worried that if I go work in another system, I'm just gonna run into the same thing again. Um, or I'm just, maybe I won't run into the same thing because maybe I will have learned my lesson, but I would have been like gritting my teeth, angry the whole time about the fact that I can't educate about it.
Yeah.
So there were some positions I applied for and I didn't even make it past the HR screen because they ask you if you've ever been terminated. And I had to say yes. So in my gut, I was like, I am so qualified for this role and I'm not even getting past the screen. It's just HR saying no because they asked, you have to explain why you were terminated. Um, so I started to think, well, what could I do on my own? And I wanted to do like my own practice, but I don't have the overhead for a brick and mortar. And so I'm like, what can I do that's low cost? And all of a sudden I was like, oh my God, concierge pediatrics. Like I can rarely get my kids in for a next day sick day appointment. I have to go to urgent care, and you all know what a pain in the butt that is.
Mhm.
And I was like, if I can provide same day visits, concierge, I'll go to their home. It's going to be less cost for me. I keep costs down for them. That was what I decided to do. And I mean, again, I was spiraling and like could not turn off my brain. And I already had some experience putting a website together. And so I just was going, going, going. We're going to do this. And basically, I kind of want, forgive me, but I kind of want to give a big F you to the institution for what they did. So I'm like, I'm just going to go out and work on my own. And we're going to make a difference, try to make care more accessible. Yes, I don't take insurance, but I'm able to keep costs low. And I'm able to teach about cannabis and not worry about being restricted about anything. So
Yeah, I'm going to pull your website up in a few minutes so we can go through it for our viewers. But one of the other questions I had too is if you could rewrite the rules of pediatric care, especially around cannabis education, what would that look like?
I think the endocannabinoid system should be the first
Yeah.
thing we think about when we educate kids on anything. When you think about the chronic conditions they have, so many of them come back to the endocannabinoid system.
Yeah.
Um, so that would be where I would start. I think that should be the first
Yeah.
approach. And
I
then if we need further support, we can add in other pharmaceuticals later, but the risk is so small with cannabis and the gains are large. So
yeah, risk. Yeah, you're absolutely right. Yeah, I mean, I even look back to, at the time when I had my son, he just turned 20. I can't believe I have a 20-year-old boy. But I look back and at that time, cannabis wasn't part of my life either. And what a difference it would have made, not only for him, but me as a mom, dealing with a child with a rare genetic disorder, who was in, the ICU for the first 5 months of his life, back and forth between Children's and Beth Israel Deaconess Medical Center, having surgeries, et cetera, et cetera. And A, it could have helped me, but B, even when he came home, I think of, well, what could I have put him on, that could have helped him, on his journey. And there's a lot of different things that I could have put him on and that would have been very helpful and easy to incorporate and non-impairing and just modulating that system so he could have a better chance, and to do more, and to recover quicker than he did from a lot of the different things that he had to go through. So after leaving Children's, you launched your own practice. This is where it gets exciting, Balance Kids. So, what inspired you to create this model and how is it different from traditional pediatric care?
Um, what inspired me was, I was searching for balance in my life, and that's why I named it Balanced Kids. I was always struggling with being present for my kids. My work days were long, always struggling with the idea of when my kid starts kindergarten, am I ever gonna be able to pick them up and drop them off? Um, and so I was looking for that work life balance. And then being a mom too, and knowing what it's like when your kid does get sick and need to go in, it's just such a pain in the butt. And I hate scheduling their well child checks. It's just so hard to stay on top of because you have to take so much time out of your day.
Yeah.
So my idea was, well, how can I bring balance to other families as well? And I believe that our healthcare should truly be patient-centered, family-centered care. And what better way to do that than to literally go to them? So yeah, that's what inspired me.
I tell you what, if going back with my children, hands down, I would have hired you in a heartbeat for sure. I mean,
Well,
it's
thank you.
hard when you have, at the time I had, and I brought home my son, who's got the NG tube, and then they had to put a peg tube in, and he had to, sleep sitting up, and crazy face like all kinds of stuff, and I had a 2-year-old and a 4-year-old. And so lugging those kids along with the sick kid to the doctors and all the visits, it's a lot. It's a lot on a mom
Yeah.
to have to do all that. So having someone come to the home is just amazing. It's just
Mhm.
really wonderful that you're doing that. So for parents listening, what kinds of services do you provide through Balance Kids, and how do in-home and virtual visits work?
Yeah, so I provide anything primary care pediatrics, so your routine well child checks, any type of sick visit, and then any type of other visit. So if you're concerned about behavior, ADD, ADHD, sleeping issues, anything you're concerned about, I'll provide you that support. And I can tell you, if I don't have your answer, I will help you find it. I am good at networking and can figure things out.
Awesome.
Um, my visits are in person. And then when appropriate, they can be virtual. So some sick visits can be virtual, right? Some other concern visits can be virtual. Well, child checks and physicals really need to be in person.
Yeah, because it's
Um,
hands-on. You got to really,
yeah,
you got to listen and feel and look at, and
absolutely.
yeah.
Um, and then another way that I'm trying to bring balance to families' life is, when those yearly or every 3-year physicals roll around for your kids, and all of a sudden you're like, crap, I got to get it in because sports is about to start.
Mhm.
Um, what I'm doing too is literally like bringing my services, say, to the football field where your kids are going to have practice. I'll get their physical done while they're at practice. We'll get forms and things collected before then. So that way, like all the slips are signed that need to be signed. I have the information I need to know for each child. And then we can just do it there. Just pull them out and practice for 10 minutes, do the assessment. And yeah, really try to fit in with their life.
That's awesome. That's amazing. Right. So that just answers the question, is how does your concierge model make healthcare easier for busy families, especially compared to challenges of clinic-based care? Well, you come to them, right? I mean,
Yeah.
you're there, you're, on the go, a green nurse on the go.
Yeah, literally. Yeah. And I think it's going to be good. And, our system is overwhelmed. And if anything, I think this model of care will benefit them too. Like, let's open up beds for the kids who truly have a high acuity need.
Yeah.
And if it's a basic sick visit for a strep test, we don't need to send them into the clinic or urgent care. We can take care of it at home.
Yeah, definitely. So you describe Balance Kids as both modern and integrative. Can you explain what that looks like in everyday care for families?
hmm so again, I definitely take the endocannabinoid system approach. So what is the least invasive thing we can do? If you come to me for concerns about your child having ADD or ADHD, my first choice isn't going to be a stimulant. It's going to be, what can we do to support your child's ECS? Like, what's his diet like?
That's
Can
exactly,
we,
that's exactly it. What is
can
your
we
eating?
Yeah, I mean, I'm sprinkling flax seeds and chia seeds into my kids' food whenever I can because they're so picky. But like, because those foods have omegas, which your endocannabinoid system thrives off of. So, like, maybe families don't want to go to cannabis. I'm not gonna push cannabis on everyone, but we can do other things to support your child's ECS too.
Yeah. One of the things that was most fascinating to me when I first started this journey, particularly when I was learning about the endocannabinoid system, the microbiome, and the central nervous system. This kind of blew me away. And how the importance of the gut microbiome, how important gut health is, and how we produce more serotonin in our GI tract than we actually do in our brain, right? And how the endocannabinoid system is the communicating pathway between our microbiome and our central nervous system. So, right, our enteric nervous system runs from our mouth to our butt, communicates to our central nervous system via the endocannabinoid system. That to me was so fascinating, and how people just don't even realize that everything that you put in your mouth, right, is going to affect, not just digestion, but even how you think and how you feel. And people don't realize that the fast food, fried food, fake foods, artificial flavors, colorings, hydrogenated oils, all of that over time is where we're seeing people start to have issues with problems. It's just, the chips and the Coke and the sodas and all of that, and just getting back to basics, let's get back to carrot sticks and celery sticks and, and
Yeah.
water, yeah. So it's just very fascinating. So if a parent wants to learn more, and I'm going to pull up your site now because I think it's important that everyone can see your website's really beautiful.
Oh, thank you.
Let's see, screens. Let's see how it looks. Balanced kids. Here we are. You can see the screen here. You can see the balanced kids, right?
Yes.
And that should be the only thing you see, I hope.
Mhm.
Okay, good. All
I
right.
can see your little different pages, but that's it.
Okay. But you can't see my, okay, good. Okay, that's fine. Yeah, fine. Just at the top bar. That's fine.
Yeah.
Very good. Perfect. So yeah, so this is your site is absolutely beautiful. It's clean, it's very professional, it's lovely, and I love it. You have, Balanced Kids, your homepage, about, book, contact, community, and blog. All really important. So do you want to go over any of this?
Yeah, so I think the main thing that I want to go over is community.
Okay,
Um,
do it.
I am, and it's not fully developed, it's growing, but
Nice.
I'm linking in other holistic care providers who are reputable and have the same idea. Like, not all of them are super focused on the endocannabinoid system, but everyone is very aware that our current health system is not serving us,
Yeah.
and it wasn't serving them either. So these are all healthcare providers who have gone out on their own one way or another to really try to meet people where they are and really serve them holistically. And so that's a big thing of what Balanced Kids is about, because I'm envisioning that one day, like, our health system can't go on the way it is. I think
No.
the way we get medicine is going to change. And I think we're all a group of providers trying to support each other and create a different avenue for families.
Yeah. And all of these therapies too, like chiropractic care, supports and nourishes the endocannabinoid system, physical therapy, movement, right, is very important. Music therapy, sound healing supports the endocannabinoid system. And I actually, one of my presentations that I did was for American Cannabis Nurses Association back in 2023, was actually on different ways to support and nourish this very important system without using cannabis or hemp. It was based on lifestyle as medicine. And so all of these different things that you're offering is so important and so critical and essential. And so, gosh, kudos to you. Good job.
You.
Yeah. And this is home. And if you want to book with her, you can get stress-free pediatric care. It's right there. Book now. So wonderful. And then you have your email right there, your phone number, your fax. Great. Great job. Great job.
Yeah, I'm really excited about it. And, things are moving along slowly but surely. And it's been very encouraging how much positive feedback I just get from everyone about it. So, yeah, I really want to work with families and, like, literally meet them where they are.
Yeah. Yeah. So do you have any final words for people, so for a parent that's out there that's thinking about cannabis as medicine, you know, and is nervous and scared, you know, what would you tell them?
I would tell them it's so safe. And stigma has shaped us so much over the years due to prohibition. And, there's a lot that happened in the past that shaped where we are today. And I think your fear is stigma based. So talk to me, talk to
Yeah.
Sherri, talk to anyone, because there's so much information to go over that I think will bring you a lot of peace and decrease your fear and
Yes.
really help you move forward with potentially doing that if that's what you choose to do.
So that's gonna, I am gonna ask one more question. So what is the thing that you learned the most that made you feel most safe about recommending cannabis as a medicine? What was
I
the thing
think
you learned?
really kind of understanding dosages and also understanding that it is not all about THC. When you're not educated in cannabis, your fear, everything you've been told, has everything to do with THC and not the hundreds of other cannabinoids in there. So, and if that's what your fear is, we can nix THC. We don't have to do THC. There's so many products. We can do everything else.
Yep.
It's like, yeah, it's
Yeah. Yeah. And the thing that I'll tell you, for me, the thing that made me feel most comfortable was knowing that my heart rate and my breathing can't stop from using cannabis because we don't have the receptors to stop
absolutely.
cardiorespiratory. That was one thing. So no one's ever died of cannabis. And then the other thing that made me feel really comfortable about it too was knowing that we make molecules in our body very similar to the plant. We have an endocannabinoid system, not because of the cannabis plant, but because we make molecules in our body that's very similar to it. And that anandamide molecule mimics the THC molecule. And again, you don't need a lot of THC in order for this to work. And that's beautiful. So Sara, you've done amazing work. I'm so sorry you had to go through that challenge with your employer. But I'm very grateful that you came on today to share your story. And I wish you the best of success for Balanced Kids. It's very much needed, and hopefully maybe Balanced Kids can be franchised all over the country someday. That's what I would love to
That's
see.
my dream.
Yeah, you'd have little franchises of Balanced Kids
I
all
would
over
love
the
it.
country. That's my wish for you.
Thank you.
So this has been a great show. I'm going to attempt one more time to see if we can close with a video. And if we can't, that's fine. We'll just close out the show. But this is one of my favorite videos that I like to share when we close out the show. It just has a lot of meaning to me. It just means a lot to me.
It means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I was cannabis agnostic for many, many years. And the more research I did, the more I discovered that cannabis is this amazing medicine.
I was told that I had a 4-stage pancreatic cancer. The doctor really told me he couldn't do anything else. He gave me her name and she called me and she came to my house. She started to give me cannabis. My oncologist was puzzled because he couldn't find the cancer anymore.
All of the learning that we get comes from the Green Nurses Group, comes from their support, comes from their guidance. I trust everything that she says.
Simply meet people where they're at. The plant doesn't, stress to grow, so we don't stress to share it. We're healing people.
Cannabis has been used as a medicine for tens upon thousands of years. Here's the big message. Cannabis needs to be federally legal. We need to have laws that are the same across all 50 states that allow access to anyone and everyone who wants to utilize this powerful medicine.